Patients with multiple myeloma are living longer with their disease than ever before, thanks to the availability of treatments that have been shown to improve survival. But what is often overlooked is the importance of the supportive care therapies that help manage the impact of the disease, including the impact on the bones. Now, since this is Myeloma Action Month, we're getting a little more educated by checking in with Dr. Joseph Mikhael, as well as multiple myeloma patient Michael Tuohy. Gentlemen, thank you so much for sitting down with me.
Thank you for having us.
Wonderful to join you.
Now, doctor, speaking of getting educated, can we kind of step back just for a moment and learn what multiple myeloma is and kind of how it's treated?
Sure, absolutely. So multiple myeloma is a cancer of the blood, an incurable cancer that originates in the bone marrow, which is the factory of our blood. And those cancerous cells, unfortunately, attack a patient's bone, giving them bone pain. It can attack their kidneys, and it also affects their immune system so that they become more prone to infections. We generally treat this condition by giving people various forms of therapy. Sometimes it's chemotherapy, as we often use the phrase, but we, as I like to say, we don't really treat cancer, we treat patients. So we look at the whole of the patient and design the best combination of therapies together, and that's what we've seen in multiple myeloma of late, a tremendous improvement in those options to better the care of our patients.
And of course, I did mention at the beginning about the impact on the bones, and what are we doing at this point, or what could we be doing to kind of help with some of those serious bone issues?
So the bone is almost universally involved in patients with multiple myeloma. So we know it's important to reduce the tumor burden with the treatments that we use, because that will help the body heal itself. But we also have strategies to help strengthen patients' bones. As we'll hear from Michael, the bone pain associated with myeloma can be awful, and it can really impact their lives. And so we now have improved strategies to be able to not only try and reduce the tumor itself, but care for the whole of the patient, which includes helping strengthen their bones.
Well, and of course, just as talking about kind of having a first-hand look on why it's important to kind of be active in your treatments and making sure, like the doctor said, we're treating the patient. What has been your experience?
I was diagnosed when I was 36 years old, and at that point in 2000, there weren't too many therapies available at that time. I went through extreme bone pain. I had broken ribs. If I picked up my son, I'd break a rib. If I sneezed or coughed, I'd break a rib. It was very painful, as Dr. Mikhael was just saying. At that point, I did a stem cell transplant, and it put me into a 3-year remission. And myeloma is incurable, but it is treatable. And the time I waited for my transplant to come back out of remission, there was a few new therapies that were available. And fortunately, I went on one of them, and I've been in remission for 12 years since.
Well, and now that you are down further down the road, do you have advice, Michael, that you would give to other patients kind of starting on this journey?
Oh, absolutely. Number one is see a myeloma expert like Dr. Mikhael here. That's very important. Try to educate yourself. You could go to the International Myeloma website, which is myeloma.org. Also, look into joining a support group. There's a lot of great support groups that are strictly for multiple myeloma patients. It's very important. And educating yourself so you can be involved in your decision-making with your myeloma expert.
Well, Michael, thank you so much for your advice for other patients, for sharing your story. And Doctor, thank you so much for giving us some education today.
Thank you.
It's my pleasure. Thank you.
We'll be right back.